Hello everyone, I'm Dr. Barry P. Swindler. I'm a chiropractor in Wake Forest. I'm here today to talk to you about low back pain. Low back pain is probably the most common reason why a person would seek a chiropractor. And today I'm going to be going into the common causes of low back pain. Now with low back pain there are many causes. There could be pathology involved here and there. We would need to take MRI, CAT scan or other diagnostic tests to figure out exactly what the cause of that low back pain. So we're not going to be talking about malignancies or pathology today, but I'm going to be talking about one of the most common reasons why people have low back pain and why they would seek a chiropractor. I have the spine here that I want to show you, and I'm just going to kind of go over some basic anatomy related to the low back. Of course, in the low back we have 5 lumbar vertebrae, and in between these vertebrae we have a disc. And the discs are the largest in the low back. We also have in this low back area, we have the muscles, of course, nerves, ligaments, tendons. All of those play a part in the function of the low back as well as the rest of the body. Well, what we have here is one of the main reasons why people have low back pain is a herniated disc, a bulging disc, a slip disc, however you want to call it. But this is actually where the actual disc has actually protruded out and is putting pressure on the nerve root right here. Now, if a person had this, they're going to have low back pain and also maybe some sciatica going down their leg or other neurologic conditions. And I'm going to show you an x-ray here of a patient of mine that actually has this going on. So with every patient that I have, I will take x-rays to look at their spine just to see what the structure is, see if there's any degeneration, any other causes of pain that they're having. And this is the lumbar vertebra here. You have 5 lumbar vertebrae, and I'm hoping you can see this right here at the L5 vertebra and the sacrum. This person has a narrowing of that disc space at this level. I've also had an MRI taken of this patient, and he has a bulging disc or herniated disc like I showed you on the spine. Getting to asking this patient about his history and finding out what caused it, he said he had a football injury about 10 years previous of this. And this is one of the common things I find with people that have pain or any type of dysfunction in the spine is that they've had an injury or something has caused it. At that time, what had happened with him, he had an injury and it's caused a spasm in some of his low back muscles. And this is where I'm going to be talking about how important it is the muscles play in the body. And that is if you have a strain of, let's say, this muscle here, this is called the psoas muscle, and it connects to the ilium and it produces the iliopsoas and it attaches down here on the femur, right inside the leg here. But it goes up here. I want you to follow this muscle up here and look where it attaches here on the spine. It attaches to the lumbar vertebra. So if this muscle is in spasm, it's going to be pulling more so on the right than the left, causing instability in the spine. We are designed to have balance in the body, and that fancy word for that is called homeostasis. So we should have an equal amount of pull left or right in the body, but when the muscle is in spasm, it's going to be pulling more on one side versus the other. They're causing the vertebra to pull one way, and over time it can allow for degeneration to take place throughout the spine. And for this case, it's right here at the L4, L5 disc level. Muscle testing is a big part of my practice. I have been certified in the field of applied kinesiology, and I have been for about 10 years. Not just for low back pain, but for whiplash. If you've seen my previous blog on that, it's a great blog about whiplash, or even carpal tunnel or any other common condition, common pain conditions. And it's good to get adjusted by a chiropractor to make sure all the segments are moving as far as spinal maintenance, but also to make sure that the muscles are working properly and there's none that are weak or in spasm. And that's one of the major diagnostic tools that I use in my office is muscle testing. And I'll just lay a patient on the table and I'll test all the muscles around the pelvis. If a person's coming in with low back pain, if I'm suspecting this, I know I'm going to find some weakness in certain muscles of the low back, and that is a lot of people seek out applied kinesiology chiropractors because they specialize in muscle testing to figure out the cause of the reason why they're having pain, whether it be low back pain, headaches, carpal tunnel, or what have you. So that is one of the common reasons for low back pain, muscle dysfunction, that's actually causing instability in the spine, not allowing the vertebra to flex or extend or rotate or what have you to give normal motion. Over a period of time, it will allow the disc to degenerate and cause the disc to bulge and to protrude on the nerve, which is going to give you pain. So I correct the muscle dysfunction, adjust the spine so that the spine is moving the way it's supposed to, and the pain goes away. Now, left untreated, this disc will eventually degenerate to the point where there's nothing I can really do to help them. That will be a surgical condition then. So I like to catch that before it gets to the surgery level to hopefully try to restore the function in the spine, to get them out of pain and to return them back to health. You can reach me at chiropractorwakeforest.com. I am located in Wake Forest at 2012 South Main Street, Suite 500A. Of course, Wake Forest, North Carolina, 27587. Also reach me at 919-349-9413, and also on my blog at chiropractorwakeforest.com. Thank you.